and welcome to ESTRO25. My name's Jo McNamara and I'm joined by fellow host Namanjolka Anderson.
Hi, Ron.
So, we have some amazing guests who literally came to just look at posters and who we were like, we need you on the podcast. So, would you like to introduce yourself?
Yeah, my name is Maeve Kearney. I am a radiation therapist, currently working in the discipline of radiation therapy in Trinity College Dublin, and I am the chair of the RTT track this year. So I'm looking forward to talking to you about that.
Great. Hi, my name is Elizabeth Forde. I am also a radiation therapist and an assistant professor in radiation therapy at Trinity College in Dublin.
You all wear a lot of hats, don't you, both of you?
This is true. We do, yes. Estro hats, Trinity hats, parent, carers, wife's hats, everything hats. Yep.
So, you mentioned the RTT track. Tell us a little bit about that.
Yeah, so the RTT track. So at the opening ceremony yesterday, I did kind of say there's something there for everyone. And I really think there is this year. I think it's very reflective of the pivotal role of the RTT along the patient pathway. So say, for example, if you're involved in patient preparation, there's lots there for you. If you're trying to implement, say, an online adaptive radiotherapy, there's lots in there for you. Also, when we talk about, holistic care, patient management, we really have quite a lot of dedicated sessions to this because this is quite an important part of obviously the patient experience, and there is a personalization of patient information symposium because when we're talking about personalized like treatment, patient-centered, like you can't omit the information that needs to go with that. So I think overall it's a very good session. We also have like a research boot camp. That will be a good opportunity if you're like an early RTT researcher. There'll be some established RTT, very experienced researchers there. They can kind of share their experience of getting research off the ground. So I think there's lots in there for everyone, wherever you are in your career. But also one thing I really want to highlight is the RTT meet and greet. Please come to the RTT meet and greet. Okay, it's at Monday at lunchtime. It's in the Stoles Theatre. So the RTT meet and greet, if you're here on your own, great. If you're here with people, come speak to somebody. ESTRO, it's not just about going to these talks, it's about networking. Like RTT community, we are like a small community. We really all should know each other, not even at a national, not even at a European level, but like globally, and we have like a massive global network now. Like say, for example, the best paper in the RTT track is an American advanced practitioner. So, so we really have a very global network, and there's no reason why we all shouldn't know each other. And even if it's just a quick conversation, you go home and it's like, oh, we're thinking of implementing this. I was speaking to somebody at ESTRO25 and I'll send them a message and see how it went. So that's what it's all about. It is about the networking. And, some people dismiss the networking. It's a very important part of being here. So yeah, please come to the meet and greet. We'll look forward to meeting you. And also we're quite conscious. So Liz and myself are members of the RTT committee, and it is the ESTRO board. We're always conscious that there are probably RTs that we're not aware of and not aware of what they're doing. So this is a very good opportunity to come, let us know what you're doing, and then we can, you can maybe speak next year at ESTRO, get yourself a job, whether that's what you want to do or not, get yourself some chairing opportunities. But we really, really want visibility of all the RTTs globally and what they're doing. And we really want to know them, and we want to just, create that network. So yeah, that's really the RTT track. Sorry, a very long answer to a very short question.
Brilliant answer. Thank you.
So Liz, as you're very important with ESTRO, where are we going next year?
Oh, that
Top
is
secret.
just mean.
Attend the GA, attend the closing, attend everything, get some tips. It's an exciting venue, and I'm looking forward to hearing the announcement.
Not fair. So what do you do behind the scenes for ESTRO?
Behind the scenes for ESTRO, yes. So as Maeve mentioned, I'm on the RTT committee. I'm also on the P&P Council. I am the membership officer for the society, and I'm on the board of directors.
Just a few things then.
I'm also involved in the ESTRO school. So I was a long-standing faculty member and course director of the Advanced Skills course, which I've just handed over the reins to Phil Shearer. I'm also involved in the AI AI course and Falcon workshops and things like that. So yeah, lots of bits and bobs to keep me busy. But as Maeve said, what I really like about ESTRO and my involvement at different sort of facets of ESTRO is the ability to find talent. And I think that's really one of the big things that we're trying to do with ESTRO is really, through Anna Kirby's presidency, moved on through Matthias now as well and on to Barbara, we're really making the society more transparent and inclusive. And that's come a lot from the focus groups that we've introduced. So to quote Anna Kirby, the focus groups are agile think tanks. But really what I see them as is an opportunity to find talent and to harness that talent and bring them into the society more inclusively. So there's a lot of journeys this year as well at the Estro Congress. So last year we had journeys developed from the focus groups. The focus groups have increased in kind of the number and the breadth of topics that we're covering, and they've also got journeys to follow. So if you go to the registration desk, you can actually grab a badge for the journey that you're interested in. So for example, AI for me. So I'm going to hop over and grab my AI badge. You can also then scan a QR code and agree then to join a WhatsApp group for that journey. So it's a really nice way to help connection at the Congress and even after the event as well, just to keep those collaborations and those networks flowing.
So can I ask, and it's putting you on the spot, it's not pre-prepared, but what do you think's going to revolutionise cancer care in the future from your perspective? Is there anything that you think is going to make a radical difference? What can people expect or look forward to?
Well, I can give a shout out to our colleague Sarah Barrett. Sarah just gave a talk this morning. It was a teaching lecture at 8 o'clock. So it was a full house at 8 o'clock, which
that's
is
incredible.
testament to the topic. So her teaching lecture was on lung cancer, and really what her take-home messages about where are we going with lung cancer, but I think it can be applied more broadly to radiation therapy, is that it's going to become more and more personalized. It is going to be data-driven. We can't, move away from that. We're definitely embracing that, but we're going to make data-driven approaches that are going to have tangible impacts for our patients at a more personalized level. So the patient is always going to be central. That's always the case. And we just need to harness the information, this huge amount of data that we're gathering, and use it more effectively, not for population-based approaches, but for individualized, personalized.
Brilliant. Well, thank you both so much for joining me. And we wish you a really happy and hopefully fruitful networking ESTRO25.
And you too.
Thank you.
Thanks very much.
Everyone.